Hi, this is for nasotracheal suctioning. So first we're going to check the patient's chart, make sure the order is in place, and then gather our supplies. We want to take a sterile suctioning kit to the patient's room. So we would head to the patient's room. Hello, Mr. Blank. My name is Trisha, and I'm with the respiratory care team. We are going to do some suctioning today. You've got that nasal airway in place, so we're going to help you remove any extra secretions you may have today. So I'm just going to feel your chest real quick, if that's all right, and I just feel some secretions there. So we're going to do what we can to help you get those up and out of there, make you feel a little better. So can I verify your name and date of birth? Okay, and then the first thing we would do with this is we're going to put some oxygen on you. We like to have you good and oxygenated, so you would have your oxygen available in the patient room. I'm going to put this mask on so that you can get some oxygen into your system. Then we're going to assess the patient, check our breath sounds, do some vital signs. With the oxygen level, we want to keep the pulse oximeter on the entire time so that we can monitor that, and if it would happen to drop at any point, we're going to stop what we're doing. So we were oxygenating the patient, and then I'm going to open my kit. Actually, before I open my kit, I want to make sure my suction is on. So you have your suctioning attached to the wall. We're going to set this at -100 to -120 for this procedure, this for the adult. So then that is on, ready to go. We're going to open our sterile kit, and then we're going to put our sterile gloves on. I want to maintain one sterile hand and one clean hand. So in our sterile kit, we have some lubrication and we have sterile saline available. So with our sterile saline, we're going to utilize that to make sure that the suction is working properly and to remove any secretions from the catheter once we're finished. And the lubrication, I'm going to go ahead and open, and I'm going to place that on the sterile tray or in the palm of my hand. So with that catheter, we're going to go ahead and make sure the suction is working correctly. So we're going to attach that to our suction. I'm going to put the tip of the catheter into the sterile saline. Then we're going to occlude the thumb port. Then we should see that sterile saline coming up through the tube there to ensure that that is working. The next step is that I will put lubrication on the end of the tip. So we're either going to use that from the sterile tray, or if we've had it in the palm of our hand, we'll rub it through our hand to complete that. So then, Mr. Blank, I'm going to remove your oxygen, and we are going to begin here. So we want to remove that oxygen. And once we get going, Mr. Blank, when you feel there's going to be some pressure down in your throat, may cause you to cough. And I will instruct you to cough. So if you haven't coughed, then I will instruct you to cough. Just breathe nice and easy for me. We do not want to include the thumb port. We're just going to advance the tip of the catheter through the nair. Slowly down through here. First resistance. All right, Mr. Blank, go ahead and cough. We'll get that through the vocal cords. Second resistance is the carina. At that point, we're going to slowly pull back as we're occluding the thumb port. So as we're pulling back, thumb port's occluded, we're going to start twisting that as we're pulling back. So as we're twisting, we're getting the secretions removed from the airway. Go ahead and remove that. The entire process should take less than 15 seconds. The suction piece of it should be less than 10 seconds. So we've completed that. Then we want to kind of feel our patient's chest, see if those secretions have removed. We have removed those secretions, so we would discard our catheter tip, and then we're going to go ahead and put that oxygen back on the patient. So Mr. Blank, we're putting oxygen back on. We just want to make sure you're good and oxygenated from this little procedure that we've done. Reassess the vital signs, breath sounds. We've monitored that oxygen level throughout, and it is maintained at a good status. Give them a little bit of oxygen, turn off the suction. All right, we'll go ahead and remove the suction or the oxygen here. Then we'll make sure that Mr. Blank is comfortable. He is sitting where he wants to be, has any questions answered, and then we will go document what we've completed.